The release of a preliminary budget is a first for Cook County. We need a more effective budget process, and I issued an executive order on June 29th mandating a preliminary budget be issued by July 31st of each year. You and I both know that government at all levels are facing serious economic challenges. Requiring preliminary budget estimates is the first step in implementing a more transparent and accountable budgeting process. This allows us not only to have a better sense of our financial landscape, but to better engage our stakeholders, including county residents, in the budget process. We're going to see a significant decline in revenues next year, primarily due to delayed collection of patient fees by the Cook County Health and Hospital System. That includes Medicaid reimbursements and overestimates by the Cook County Health and Hospital System of their revenues. We're also going to see a $53 million reduction in revenue due to the implementation of our sales tax decrease. I made a promise on the campaign trail that we would eliminate the rest of the Stroger sales tax increase, and we did that as part of the passage of the budget in 2011. I thought then, and I think now, that that was good for the working families of Cook County and good for our businesses, but it does have financial consequences. The third impact on our budget deficit, our gap, is the timing of the 2012 tax sale and the increased cost of 2012 elections. This is a presidential year, and the reduction in one-time revenue sources such as one-time collection of delinquent debt. While typically expenses would be expected to rise, the 2012 preliminary budget indicates a decrease in expenditures. This is due in part to the continued work our county has engaged in to reduce expenditures across the board. We're doing a better job of purchasing goods and services. This is an initiative from our transition report, and it reduces 2012 expenditures by close to $25 million. In addition, the county expects $4.5 million in budget savings due to our new electricity contract. The focus of the next several months will be to work to reduce expenditures and work with everyone to identify ways to control the cost of government during this difficult economic time. Yesterday we had 7 sessions with our budget director, who's probably hoarse by now, with our county commissioners and every one of our union groups. So we met with our trades, with AFSCME, with SEIU, and with the Teamsters, briefing each of them separately. We asked for their ideas, not only about potential efficiencies, but also about cost savings. This report also provides a mid-year estimate of current fiscal year 2011 expenses and revenues through the end of the year. Fiscal year 2011 indicates that the general fund for Cook County will have an estimated shortfall of $116 million. $116 million. I would point out that $96 million of that is in our health care budget. So of our $116 million shortfall, thus far, $96 million is projected to come from health care. Expenditures are projected to come in under budget by $5.7 million, and revenues fall short by a total of $122 million. Again, this shortfall is due primarily to slower than expected reimbursements and collection of fees by the Cook County Health and Hospital Systems. We're already taking steps to try to manage the expected decline in revenues. By executive order, I will ask separately elected officials in all the departments within the President's office to reduce non-personnel expenditures by 5% for the remainder of this year. Additionally, my office is continuing to work with the state to process the applications for Medicaid that enable us to bill for services delivered to the Medicaid eligible. With the fiscal pressures that have related to rolling back the sales tax increase, managing our health care system, pension and retiree health care benefit costs, we must be diligent in our work to increase fiscal responsibility and accountability throughout county operations. In addition to the preliminary budget, the June 29th executive order also called for a public hearing, which will be held August 25th, 2011, in order to more fully engage the public in the budget process. It's very important that the people of Cook County gain a meaningful understanding of our $3.2 billion budget and the role of the President, the Board of Commissioners, and the county's separately elected officials in the budget process. Quite simply, Cook County residents deserve to know where their tax dollars are being spent. We're going to open up the process in public hearings and give the citizens of Cook County an opportunity to weigh in on important decisions in the budget process.
When I became budget director less than 3 months ago, the President asked me to begin the budget process earlier in the year, improve budget transparency, ensure input from various constituencies, monitor and control current year expenses, and prepare creative and responsible solutions to improve the financial sustainability of the Cook County budget. Issuing the preliminary budget today is one of the first reflections of these goals, as it helps to frame the financial issues that we are facing as a county. The 2012 decrease in expenditures is due to the impact of strategic sourcing and reduced claims that are expected. And this decrease is despite some rising personnel costs. I'd like to mention that without the efforts already undertaken by the administration on healthcare benefits and electricity sourcing, the gap would have been $25 million more. As we work towards closing this gap, we expect the strategic sourcing effort to yield additional savings on contract costs. The 2012 budget will also include some of the initiatives outlined in the City-County Collaboration Report. The Department of Budget and Management Services will now focus on working closely with residents, union leaders, commissioners, other elected officials, and department heads to review other potential efficiencies or cost savings that will allow for the presentation of a balanced budget recommendation in October.